This is our case of IT band syndrome, and it's been 2 weeks since we saw her for her first visit, and we were able to free up a considerable amount of mobility in the foot and ankle complex. But today she comes back and had a reduction of dorsiflexion mobility, and we went ahead and mobilized talus on this side, which of course has a huge effect on multiple inputs, multiple neurological phenomenon, such as addressing the receptors in the tendons, ligament, muscle, joint capsule, blah, blah, blah. We distinctly gained range in that right foot in dorsiflexion, and she was able to actively dorsiflex more. Okay? Then I had her self-treat the left side, and then checked all other accessory motions throughout the foot and ankle, and all of them were then normal until we came up to the fibular head. And this is, she points out, it's exactly where she hurts primarily. Can you point it out?
Right down in there.
Okay. So you're touching the fibular, you're nearby. Go ahead and put your finger. Okay.
Right back there is
Very
where
good.
it usually starts to hurt, and then it'll come around sometimes.
Okay, do it one more time. I didn't capture it.
Right back there.
Yeah, so you're pointing right behind the fibular head. So fibular head is right here. Okay. And I'm the cameraman. And you were starting out back here, correct?
That's where it starts.
Okay. Alrighty. So lay down. And it's unusual for the fibular head to be anterior with a supinatory pattern, but we do see it on occasion. And it doesn't move posteriorly. And when you're prone, it doesn't appear to be positioned posterior. What I'm going to do is lean on this fibular head with a slight lateral and an AP direction and see if we gain mobility. If we don't, then the appropriate thing to do would be to have you on your stomach, and then I'll do a PA. But I'm quite confident that it's going to gain mobility. But with a reasonable amount of force, I'm loading it and I can't take any slack out of it, and now I'm up to about 15 pounds and there's no yield, no force transmission, so I'm going to stop here and go ahead and treat it.